What to do when you actually go to a doctor's office and you're suspecting pelvic floor issues, or you have pain in your pelvis, and it's really a very, perhaps even embarrassing thing for you to want to talk about. That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. Pelvic floor dysfunction, which a lot of times people think of as pelvic floor issues, can be a little bit embarrassing subject for some people. I want you to know that when you go into an office whose job is to take care of pelvic floor dysfunction or is related to health, this is not something that's embarrassing to us. It's embarrassing for us to hear someone else talk about. It's really as generic of a subject to us as it would be if you came in and you said you had shoulder pain. So have that mindset before you work your whole anxiety up over the thought of discussing something that is more on the private part of your life. And then when you're talking to your doctors or therapists, ask questions. If you are given, let's say, a medication, you want to know why you're taking it. If your test result is negative for something, but you're continuing taking that medication, ask your prescribing physician why you're still taking it. When you're going to a therapist office, tell them how you feel uncomfortable, for example, to receive internal examination, if that's not something you want, and ask if that's 100% necessary. If there is a way to not do that and do other things and still have that in the background in case you need to go through that route. If you're uncomfortable being with your pelvic floor therapist and you wish to have someone with you or someone from the office with you, ask for it. I want you to know that when you go for pelvic floor dysfunction, if it involves internal examination, we're not going to go in and look at you as much as being close to you to examine you. So it's not like checking you out. So have that in mind, because these are questions people have, but they're too embarrassed to ask, but they ask other patients or other people who've gone through the process. Is there any special diet to have before your treatment? That's another thing that people wonder. I mean, do I need to not eat? Do I need to do anything? So the answer is not necessarily, though probably wouldn't be a bad idea. Just don't starve yourself, kind of thing. So if you have any other questions that this video did not answer, make sure you use one of the methods of contact in the description box. Contact the office. We'll be more than happy to let you know how it is in our office. If you have not subscribed to the channel, please do so. If you have any questions for videos or comments or suggestions, please let us know as well. Thanks for watching. Take care.